right hand drop.
Oh.
Good, let that fall. Let this pressure build up right here underneath my thumb and relax into my pressure. There you go, good.
Oh.
Looser, looser.
Oh.
Good.
Oh, man.
Hey everybody, it's Dr. Warren here at Kalkstein Chiropractic. Today I'm with Kevin. Kevin is currently in a pretty heavy training regimen right now, and he's been in that regimen for 6 months?
Yeah. Just maybe a little less.
A little less?
Yeah.
5 months, let's call it.
Yeah.
Okay. So you came into our office in the beginning of that training regimen. You had pretty severe jaw, neck, shoulder, hand pain, numbness and paresthesia in the left arm, the whole left arm. You'd seen, let's just call it a few people before us, right?
Yeah.
Where you were getting different diagnoses and different types of treatment for various conditions, basically, okay? So that can happen with any type of problem coming in, because a lot of things can duplicate themselves and can present in different ways to that practitioner, especially when they have a different background. Okay, so let's just call that what it is. All right, so you came in to see us, and we diagnosed you with some TOS symptoms as well as some cervical radiculopathy that you had going on, right? And we treated you in the beginning, and we put you more on a heavy training regimen afterwards, right? Mm-hmm. Now we're back to treating some of these symptoms that are popping up as you're getting more intense with your pull-ups and your push-ups, and so he's a really interesting case in terms of when he has hand numbness and jaw paresthesia or numbness, right? And it's when he swims. So there's a certain swim, especially in the military, that they do where your side, it's called the side stroke, right?
Combat side stroke, yeah.
And tell them a little bit about what happens when you go into that swimming pattern.
So when I lift, I don't know, I guess when I tilt my head and I put my arm overhead, I get numbness up through my cheek and jaw area and a real big strain on my neck, and then my shoulder and my hand, I get tingling in my pinky, and my shoulder just has no power in it. Just feels super weak, and I can do all the other exercises, but it's right after I get out of the pool where it really seems to fire up.
So we were doing well for the last, I'd say, honestly, probably a month prior to this. 3 months you were solidly progressing, right? Mm-hmm. But he didn't have access to a pool with COVID, hadn't been able to really train himself in that pattern of swimming that's exacerbated in the past, right? But you weren't able to do pull-ups, you weren't able to do push-ups. We got you back to do it. I mean, what are your reps now? You were, let's just call it 0 in the beginning, and you've been consistent with your training. What are you sitting at now?
Pull-ups I can do 20 plus, 22, 23 maybe when I'm fresh, and then push-ups I probably bust out 60 consecutively, and then muscle out another 20 without taking a pause at the top. So that's gotten way better.
You might take that watch off for me. Yeah, and gradually so, right? It hasn't been like overnight, but in a healthy way, you've kind of pushed yourself and worked on the shoulder as well as just training yourself in a safe environment, not overtraining, because you ran into that pattern in the past too. Mm-hmm. Okay, so I'm going to show you, he responds well to dry needling, he responds well to soft tissue work, and the adjustments. We've gotten away from dry needling in the last 3-4 months, and we've really just been focused on strength training for him. So he's coming in, and we're just going to treat some of the symptoms that have started to pop up on him recently. And we're tweaking the way that he does a lot of his shoulder movements. That's the next kind of stage with him, because I really think that he has to focus on this left shoulder, and there's what's called DNS exercises that we're going to show him how to do going forward. Started doing some of those this morning. How'd they feel?
Good. And it tested the shoulder. It started to wear down, but it felt good.
You fatigued it?
Yeah.
Okay. So we're working the masseter muscle here. So if you look up Travail trigger point maps, you get a good idea of why pain can refer from the scalenes into that jaw area. He clenches a lot when he lifts. Have you seen some of the trigger point mapping where they kind of show the little dotted spots where pain can refer? So what they did with those pressure.
Is that the scalene there?
Is that where you get a lot of release from dry needling?
Yeah. That and the upper trap seems to really
set you up.
Yeah, but those like graphs are pretty amazing in terms of describing where I feel the.
Yeah, so what they did was they would go in and they would load up that spot, just like the trigger point trigger point injections. Kind of that same series of studies where they did not something that solved the problem, but the opposite, an irritant into that area, right? And so they would send an irritant to that tissue, and they would see where pain would refer to.
Is the scalene that whole thing, or is it part of that the SCM?
So the SCM wraps over top and comes down towards basically your chest. Okay, the scalenes are more attachments to the first rib, and they actually go more towards the cervical spine. The SCM attaches right up here. So when I do the scalene, I'm going a little bit deeper, and I'm palpating those ridges, and you can kind of feel the edge of that muscle right there. There's the border of one of your scalenes, right? You have three groups of scalenes. Basically, it's front to back. Okay. And I'm a little more superficial than I'd say if I needled your trap. No pressure. How you doing?
Good.
Good. So you can kind of even see if you watch that. If you play that back, I had a trigger point in his trap, and you can see how all the needles twitched there, all the way from his shoulder to his jaw. And that's a reflex from him also clenching his teeth because it was an intense sensation. It's not from the true. This isn't causing those muscles to contract because of that. It's more of a referral, but that trigger point in that trap can be pretty sensitive on people. You doing good?
Yeah.
Doing well? So he's got a history of right shoulder surgery, correct?
Yeah, right labrum a couple years ago.
And successful. You haven't had any problems since then? Deltoid here. Breathe.
I'd be tempted to say that was almost easier to deal with.
I hear you. TOS is can be really tricky. So what they want to do with TOS patients a lot of times, from a surgical standpoint, is to start removing things, right? And have they offered that to you?
Yeah, they said that they could take out my first rib, but a lot of people, I think you included, have said that let's try to avoid that.
Yeah, and I even think that the people doing those surgeries would say the same thing.
Yeah, they have. They don't want to do, because they say a lot of times, or at least the doctors that I spoke to, that your power and strength to get back to where you were before the surgery is really, really difficult after that.
Pressure. Easy. Good. There you go.
Oh, what is that?
It's your teres minor, teres major, those lower rotator cuff muscles.
Jeez.
points can occur like that are really hypersensitive tissues, and you want to jump down the rabbit hole why those occur. I think someone that I worked with at school that worked with the Cardinals, he was pretty engrossed in research and really just in the medical community in general. But trigger points can be a good thing in a poorly functioning system. So what does that mean? So when I watch Kevin move, the way that he stabilizes his shoulder and different exercises kind of sets him up to be really tense in a lot of different muscle groups. And I'm going down the chain working on those different muscle groups that can house these trigger points, that can house these areas of irritation.
What was that one? The pec minor?
Mm-hmm.
Holy cow.
So we worked on his masseter, his scalene, his trap, his SCM insertion, his pec, deltoid, his teres minor, teres major group, those muscles of the rotator cuff, teres minor being, and then we did his extensor carpi ulnaris muscle. We did his basically the brachioradialis insertion, or that there's a trigger point that gets housed in this extensor group from the radial nerve, and so just a more of a global treatment for a shoulder TOS problem. He's got paresthesia in the jaw, and we're going to adjust him after this. Kevin, you comfortable?
Yep, thank you.
You're welcome. Hey everybody, welcome back. So Kevin's back here. We just did dry needling on the jaw, shoulder, and to the forearm, and then we had some laser therapy afterwards on some of those trigger points that were a little bit more fired up this morning.
Yep.
I'm going to show you how I adjust him in the chair in his first rib. TOS, you heard what we talked about earlier, they remove the first rib because it puts a lot of impingement on some of those cardiovascular structures. So getting it to move is really important, right? So we're going to show you how I adjust the first rib. I'm going to show you how I adjust his occiput and his jaw. We do a little soft tissue work in those areas, and then I'm going to work the forearm and the wrist a little bit too, okay? And then he's had a history where he threw out his low back when what'd you do?
I was golfing, and I had such a terrible swing. I don't know what happened, but I couldn't move for a week.
So, did you beat your brother-in-law?
No, we actually lost hand up. We did lose, but it's not like he shot well. I mean, he shot like 115. I shot like 120. So
he's not that great.
No, we all stink.
Rotate your head to your right, head to your left, nice and easy. Good. All right, stay right there for me. You're gonna feel pressure here and a release here. Okay. Relax your jaw for me. Good. Let the shoulders loose. Good. Take a breath in. Nice and smooth. I'm gonna come to you. Exhale. Let everything fall as I come to you. Good. Good. Right hand drop. Oh. Good. Easy. All right. Come back towards me. Slouch just a tad. Right there's good. Breathe in and exhale. Loose. Breathe in. Breathe in and exhale, nice and loose. Relax. Nice and loose. A little pressure right here, okay? Good, let that fall. Ooh. That's it. Good. Come up nice and tall for me. Good, on your back over here. How you feeling?
Yeah, this moved pretty good.
Yes. Okay. Let me see that hand. So, went in and tried to hawk some golf balls. I probably see 2 or 3 of you a week at least.
So, we started out with, I don't know, probably 12 balls, and by hole on the back 9, I needed to go get more balls. That's how bad we are. Like if I'm trying to drive this way, I'll square up facing you because it'll naturally just kind of swing back. So occasionally I'll hit it how I'm supposed to hit it, and it'll just go directly into the woods because that's where I'm facing. But I got to play the odds, so most times it'll swing back around.
You aim your hips 45 degrees to the left?
Yeah.
That's pretty significant.
Oh, it's terrible.
I'm sure people are scared.
Everyone, like, if someone hasn't played with me before, they're like, "What are you doing? Like, the hole's this way." I'm like, "No, you'll see." Not proud of it, but.
Flex your wrist down and curl it towards this side. Good. And reverse. There you go.
You know who's good is Drew.
How's Drew doing?
He's doing good. He's doing real good. Working out hard.
That's awesome. Good. So, what was he hitting?
He shoots in, like, depending on the round, like upper 70s, low 80s, and it's like a true score. I mean, he doesn't BS.
Awesome. Relax here for him. That's good. Just checking the ulna and the radius. He moves really well on his elbow. Just some tension here in this this flexor group right now on the outside of his arm, right on the ulna side. And so just working that, we put a few needles in the trigger points there. And then I'm going to show you just some passes over the different areas that I worked on. I'm checking the tissue to see how it responded to what we just did, but I'm just following up with some motion, some active range of motion on that tissue that we were treating. Okay?
Yeah.
Your first rib is starting to move really well with some of these adjustments. Breathe. So Kev's got a big goal that he's working towards in September, and we're on the same game plan here. I got something going on in September that I gotta be ready for too.
We should pull the crowd and ask them about post haircuts. If people think they look good as soon as they walk out of the barber, or for me, I think I look my best 2 weeks post haircut.
2 weeks? 2 weeks?
Yeah.
So I didn't know this was a thing. I never really thought about it too much, but I've got a date September 6th that I really got to show up for, getting married. And so we were talking about how soon should I get my hair cut. Is it right before? Do I want that completely fresh, clean look? Do I want to grow it in a little bit? A week after, 2 weeks after? Now the problem is that I haven't practiced this before.
Yeah, you have no time.
So I'm just gonna wing it. And I'm thinking a week and a half. I'm thinking that's what I'm going for. What is your time frame? You want it the day before? You want a month out? Liam here is just looking like a hippie. He's just going. He's growing it out on us.
I'm definitely a 2 week guy. I for whatever reason, I never really feel that good when I'm walking out after I got a haircut. But 2 weeks in, I'm like, all right, that's starting to work.
We should ask Tegan what she thinks about the hair flowing back on you now.
On my hair?
Yeah.
No, I did ask her. She said she likes the volume.
She likes the volume?
But she says I could use a little bit of gel. It's a tough crowd.
Tough crowd. Loose. Pressure. Easy. Good. There. Pressure.
And then what do you sometimes go clean shaven, sometimes mustache, sometimes goatee.
Yeah, you don't know what I got going on now, do you?
So that's another thing you got to put into the fold for your big day.
Just straight mustache.
Mustache?
She says yes to that, and I'm good. I'm good for life.
There you go.
All right, Kev.
Thank you.
Come on your stomach. Let me just get that low back, and we'll be all set to go. Okay. Deep breath in. Lift your chin up for me, and exhale. Let it drop. Let it drop to the table, the chin. Good. Now breathe in again. Let this pressure build up right here underneath my thumb, and relax into my pressure. There you go. Good.
Oh.
Looser, looser.
Oh.
Good.
Oh, man.
All right.
Thank you.
You're welcome. Maybe you don't have to line up so far.
We'll work on it. We'll definitely work on it.
Bring it in a couple degrees. Hey, thanks for watching. Appreciate it. Kevin's got a really interesting story, so we'll kind of jump back into it from time to time as he's doing strength training on his own 4 to 5 days a week, and I'm kind of helping him program that a little bit. But then he's coming in here for just the periodic dry needling treatments and the adjustments, trying to do as much as we can. I'm co-coordinating with another practitioner, so I've referred him on to getting some treatment in another facility to see if it can speed up his recovery, because he has a really shortened timeline to get ready over the next month and a half. So it'll be an interesting case to follow along with, and I'm sure you'll find Kevin interesting as well too.
Thank you very much.
I'll see you. Thanks for watching.